I'm Bryan Palmer. I am a licensed clinical social worker. I'm also a qualified supervisor in the state of Florida. I'm licensed in Arizona, and I'm licensed in California as well.
Arizona too. That's
Arizona
cool.
too, yeah. I'm a certified sex addiction therapist and certified through ITAP, which is the International Institute of Trauma and Addiction Professionals, which was started by Patrick Carnes probably 30 years ago.
Being a certified sex addiction therapist is a serious commitment of time, energy, studying, supervision. The fact that you did that, and I know people that have done that from my time in other parts of the country. It's a serious commitment. So congrats for doing that.
Oh, well, thank you. Yeah, it's not an easy certification. It's about a month of classroom spread out over 4 weeks, plus supervision hours. And the hard part now is it's done via Zoom. It's not done in person, which makes it that much more difficult. Yeah. But there's other subspecialties within ITAP for betrayed partners, for pastors who work in churches. There's one for substance abuse. There's one for financial disorders.
The greatest, and he's helping me so much.
And the list just continues to grow. Stephanie Carnes has taken over from her father, Patrick Carnes.
I enjoy what I do.
And really grown the organization and really grown.
I do it. It's almost a mission.
The offer. We had 2,000 people at the annual conference
there's sex therapists, which
are
certified by
it was in May.
And then
in
there's
Phoenix.
certified sex addiction therapists.
And I think that was one of the largest conferences we've had.
Some are cross-trained. I'm not. I'm
it
just
was
focused
3 days.
On sex addiction recovery.
And is that the type of conference that you're
like most of my colleagues, we're also very
continuing
sex
education
positive.
Unit, so that
we
you
want
keep
people
up
to
your
have
certification.
We need. They ask that we do 15.
So long as there's transparency,
15 CEUs every 2 years. However, there's something every couple of weeks, which is always of interest. So lots of participants, lots of CSATs go way over. And
it's a field. It's a brand. Listen, I started working in the addiction treatment field in 1986.
Yeah.
There was the only discussion about sex therapy was therapy for people who are struggling with intimacy in their relationship, and there was the Masters and Johnson methods of, and there was no discussion. But that, what we know is infidelity and betrayal in relationships has been going on forever.
For millenniums, yeah.
Yeah, and marriages and relationships have broken up as a result, and now we have people like you have, been bold, and if you can talk for a minute about your career path and how you changed your career, and you came into this.
Happy to.
Which is cool, and I'm one of the fortunate people who knows you and gets to refer clients to you.
Oh, well, thank you.
And to a client, there's not one that's ever come back and said anything but thank you so much for referring me to Bryan Palmer. The guy is the greatest, and he's helping me so much.
I don't know if I'm the greatest, but thank you.
Well, they say you're the greatest.
Well, I enjoy what I do, and it's not easy work. It's hard work, but I do it. It's almost a mission. I should point out that there's a distinction that probably is helpful to be made. There's sex therapists, which are certified by ASECT, and then there's certified sex addiction therapists, which are ITAP.
Right.
And some are cross-trained. I'm not. I'm just focused on sex addiction recovery, and like most of my colleagues, we're also very, very sex positive. We want people to have healthy sexual relationships with open minds, so long as there's transparency, honesty, and an emotional connection.
Fantastic.
Yeah.
I believe that's the way as well, because something as natural as sex to give people these crazy restrictions that it's going to be almost impossible to,
Exactly, we're a very open-minded group of people. We just want there to be honesty and transparency and between partners and in relationships.
How did you get into? I know that you had a previous career.
Yeah.
Before you became this rock star therapist,
I'm not a rock star therapist. I sold advertising for Time Magazine. Actually, I started with Dow Jones in Chile. I graduated from Cal Poly, strike that, start the tape over. Graduated from UC Berkeley in 1989 and then moved to Santiago, Chile. As sort of a rite of passion, I wanted to cut the umbilical cord and grow, I suppose. I was working for an Episcopalian bishop in Berkeley, managing a boarding house that he owned, and he wanted to pull me into the church and encouraged me to become a priest. And I said, no, thank you, Father Morse, and ended up heading to Chile. He sat me down one day and said, what are you going to do? And this was in June of '89, and I was graduating from college that month. He's like, what are you going to do? And I said, I'm going to go to Chile, because at the time, Chile as a country was the only country that was prospering. Pinochet was headed out. He had lost the plebiscite. And I arrived November of '89, right when the elections were taking place. Mm-hmm. And his candidate, Hernan Bihi, lost. Patricio Aylwin won, who was the Socialist Democrat. So I got to see the whole transition. I was in Chile for a year and a half. I left thinking I was going to come back and work on a raisin project, exporting raisins. That project fell through. So I was in California, and I got a call from the folks I'd worked for in Chile, because I worked for a company called America Economia, which was owned by Dow Jones. Mm-hmm. It was a business magazine that circulated in Latin America. And they said, why don't you come to Mexico, or would you be interested in coming to Mexico? We want to open up a sales office. And I said, sure, I'll come talk to you. So I did. So I moved to Chile in 1992, I guess it was March, April 92, and started selling ads for them, hustling, not making a lot of money, but grew and learned how to sell. And Mexico gave me so much. I was there for 9 years. Was with America Economia through the end of '94, and I got a call from a headhunter, and they said Time Magazine wanted to open up an office in Mexico City. So I said, let's talk. And spoke to the headhunter, spoke to the publisher, a guy named Hugh Wiley, who was a mentor of mine, and took the job and became the director of sales for Latin America. Wow. For Time Magazine, based in Mexico City. And then grew the territory and kind of grew my position and became the VP of sales for Latin America, and was with them from '94 to the end of roughly '99, when I moved back to the States, moved to Miami to work on an internet startup called America Economia. Totosport, which was a portal for football sites, soccer sites in Latin America. And this was in the Wild West days of the internet, and everything was booming, and we thought we were all going to become millionaires, and it didn't work out, obviously. And then I crashed. I hit an emotional bottom, and spent a bit of time in a local psychiatric ward for about 7 days, and I had a nervous breakdown. And thank God, my mom and my stepdad said, hey, just come home. So they sent me a ticket the day I got out and said, fly home. And, they probably spent a lot of money just to get me home that one day, but I'll never forget that day. So I spent a year kind of chasing my tail and waiting for the next project, and hadn't yet got sober. I knew I had to. And by the way, Mexico was a great place to be in active addiction. Alcohol is consumed at lunch pretty regularly. It's encouraged, and moved back to California, and ended up spending time with my mom and my dad and my siblings, and they kind of just took care of me for about 9 months. And then I got a call from AOL Latin America, and they said, would you like to work with us? And I said, sure, let's talk. Did that for about 6 months, and then we agreed that it would be best if I left. And they were actually very generous. They were very generous, and got a nice severance, and then chased my tail for about 6 months, and then ended up going to work for a Mexico-based magazine publisher called Expansion. And was managing a small sales team here in the U.S. to target U.S.-based advertisers interested in reaching Mexico and Latin American advertisers. So we did that. But before I did that, I got sober. I got sober in December of 2001 from alcohol and cocaine. And 2 years later, got sober from sex. And without disclosing too many personal details here, I just decided that was necessary too.
Yeah.
I met a guy named Sean McFarland who was a sober coach at the time. And if you look Sino up, he's on social media. Really, really nice guy. But he was the one who suggested I look at SAA. Mm-hmm. And I did that. And
Sex Addicts Anonymous?
Sex Addicts Anonymous, yeah. So I started a local chapter. We started meetings at 1718 Bay Road in Miami Beach. Started with one meeting, and then went to twice weekly, and then we were up to 9 meetings when I left at the end of 2009. Those meetings are still happening. But those years were turning points. I did go back into publishing, and I was in publishing until the end of 2008 when I went back to school and moved to New York and went to Columbia and got my master's in clinical social work at Columbia. Knowing that I wanted to focus on addiction and recovery and trauma. Yeah. Trauma is also a big part of my practice. What else can I tell you?
So moving from, you had a full major career.
I had a full major career.
Found yourself, arising from the ashes, so to speak, and then becoming reborn with a new life and an opportunity to help others, but doing it the right way, going to school, learning techniques, because a master's in social work, I know from experience, is a lot of good clinical sound skills and practice.
It is. It's
good base.
It's 2 days in class and 2 or 3 days in the field working in marginalized settings. So my first year I was in Jamaica, Queens, working at an at-risk high school. Well, when I say at-risk, there was metal detectors getting into the school. And I worked in a project that was funded by the United Way to keep kids in school, to work with the truants. But the irony is that we needed them not to be in school so that the project could get funded. So the incentives were a bit mismatched. But I learned a lot. And that was a hard transition. I have to admit that was a difficult time. That first semester was a big transition, because I had gone from a job where I was needed and successful and enjoyed. I loved to sell. I still love to sell. I liked the marketing, and I liked managing people. Mm-hmm. I really, really loved managing salespeople and teaching them and helping them to develop relationships. So that first semester in New York was tough. That was a big adjustment. Yeah, I have to be honest. There was a bit of depression and anxiety and questioning, and I got through it and have no regrets.
You knew that wasn't what you want to do for the rest of your life, working in that population.
Well,
you knew that there was more to...
I knew that I couldn't sell ads anymore because the magazine industry disintegrated really literally when I left at the end of 2008. Magazines just became disintermediated, to use a big word. They began to disappear.
Yeah.
And Time Inc. broke up, and Condé Nast has been broken up, and that whole industry is just not what it was. So thankfully I was at the glory. I enjoyed some of the glory days of Time Inc. But that industry's gone.
Yeah.
It's I knew I had my teeth into something that had a lot of life left, and I knew that becoming a therapist would be something that I could do for a very long time, and I can die with my boots on doing it.
Yeah.
And we get better in time. We get quicker in time. The more practice we have, the more people we see, the better we get, and the quicker we are to diagnose, and also the more direct we can become, which saves people time. So at this point, I don't mince words with my clients. I'm gentle and kind, but I'm pretty direct.
It seems like you do sort of an interventional type of therapy when you do that, right? When you're more direct.
Absolutely.
You're not looking to see clients for 30 years of long-term.
No, I'm really not. Look, one of the first things I tell them is that it's not ethical for me to see a client if they're in active addiction. There's 12-step programs that address that better. So I don't see alcoholics, substance abuse, or active sex addicts if they're in active addiction. They need to get into 12-step for a couple months. They need to find a sponsor. They need to start working a program so they can get a base of sobriety. But alcohol and substance abuse is easy to measure, right? Sexual sobriety is a bit more difficult. It's a bit more sometimes nebulous, depending on the program one's involved with. And there's probably 6 or 7 different S programs out there, from Sex Addicts Anonymous to Sex Anonymous to SLAA,
yeah.
Sex and Love Addicts Anonymous, Sexual Compulsives Anonymous. There's a whole host of church-based programs, which are great for people that are more comfortable in a church setting. But they need to get a base of sobriety to get going on some of the CSAT work, which is task-based, which is trauma-based. And it's like trying to treat an alcoholic who's actively drinking. It's impossible.
So that's a clear philosophy that you have, is that if, I will see you, we can do this work together in therapy. However, you have to be
committed
in recovery, in a program of recovery, working on yourself, and show me that you're doing that, demonstrate that, and then we can do this work, this deeper work that we need to do in therapy.
100%, exactly. And from an interventionist perspective, I'll start with them, and if we have to intervene with a bit more direction and get them into treatment, then we'll do that as well. And there's a host of, there's short programs, there's longer term programs, there's Prospect Hill, which is 3 months. There's PCS out in Phoenix, which is a week to 2 weeks of very intensive work, which is great for diagnosis. There's McLean in Boston, which is more mental health driven. I mean, I don't have to tell you.
But that's what you're sharing is exactly what, the belief is that we're not talking about an event, we're talking about a process. And that the process of, you seeing a client intervening, saying, you'll benefit from going to Prospect Hill and St. Croix because you need the privacy, exclusivity, they're going to get you started, and then we're going to come back, you're going to see me in my office, and we're going to do this work, be it
in a perfect
trauma.
Exactly, in a perfect world. Because the real work of sobriety begins the day they return from treatment, right? It's a luxury to go to treatment. Not everybody has that luxury.
Big time luxury.
Yeah. And whether it's Prospect Hill or something, some community-based, it's still a luxury. The ability to take a month off and look at oneself and get sober and get drug tested and to have a layer of accountability, that's a luxury.
Yeah, most people don't see it that way. I'm glad you're saying that, because people see it as either a punishment or the guilt and shame involved with having to go away and get help. But you're right, they're fortunate to be able to do so and do that interpersonal deep work and get stabilized so that they can come back and do what I consider is the really heavy lifting long-term therapy with someone like you. When you talk about, you mentioned earlier, you talked about your getting trained as a trauma therapist as well as a CSAT, and your own personal recovery. What made you decide to take that combination of trauma and CSAT? Something had to click there for you.
Well, so I think every therapist in this country needs some sort of a trauma intervention, whether it's EMDR, whether it's somatic experiencing, whether it's prolonged exposure, whether it's ETT. We need some tool to help people work through their trauma. People don't just develop alcoholism out of the air. Some people do. Some people are predisposed, whether it's genetic, whether it's environmental. But often bad things have happened to people, and they develop a need to medicate. And that need to medicate is often takes.
How do you get there? How do you get to when you're early on and you're meeting client? How do you get to the point of, hey, let's try to figure out what happened? Or
well, that's a really good question. If I'm lucky enough to gain their trust, and I don't take for granted that just because they come to my office, I have their trust. I have to earn their trust. It's incumbent upon me to earn trust. I don't assume that, and that takes a bit of time.
Yeah.
So once we have some trust established, and once there's a bit of a base of sobriety, then we can look at kind of what I would say is under the hood. Because at the end of the day, this is a bit of an aside, but AA is not about alcohol. SAA is not about sex. Gambling Anonymous is not about gambling. Food Anonymous, the Overeaters Anonymous is not about food. It's about life, right? Those are just the symptoms. So we help people arrest the addictive behavior, the compulsive behavior, the impulsive behavior, and find sobriety. And once they're sober and learning to tolerate uncomfortable feelings and learning to develop some insight into what's driving these uncomfortable feelings, then we can begin to put together a trauma timeline and look at events that have happened over the course of their lifespans. There's something called the Adverse Childhood Experiences Survey. I think it's 20 questions. And what it tells us is if a person's had one traumatic event, they're going to probably be okay. But if it's 2, 3, 4, the likelihood of developing mental illness and addiction skyrockets.
That score goes up.
That score goes up. So if it's above a 4, then we're pretty sure there's going to be a higher incidence of addiction and mental illness.
So do you explore that ACE score with clients?
Yeah, it's actually one of the first things we do. You know, we give a battery of initial surveys and tests to kind of see where people are. We look at anxiety, we look at depression, we look at PTSD. We give them the PCL, which is a pretty short survey of the PTSD diagnosis, which is basically five principal clusters. And we always look for criterion A, which is physical sexual abuse or exposure to physical sexual abuse or violence, or vicarious abuse. First responders, for example, who have come to a scene after somebody has been murdered or knifed to death or beaten up.
Yeah.
And they are traumatized. So we need criterion A to fulfill the PTSD official diagnosis. But that doesn't mean people don't have PTSD. Not everybody does. They can still have symptoms of PTSD. I use EMDR, and I've enjoyed using EMDR. I got trained before I got licensed, and I'm level 2. Will become level 3, a consultant at some point in the next 6 months.
And EMDR stands for eye movement desensitization reprocessing. Is that right? Eye
movement desensitization reprocessing.
Reprocessing.
Yeah. And what do we do in EMDR? We effectively go back and look at a painful event, and we identify a negative core belief associated with that event, and we identify what a person would like to believe about that event. And then we come up with a score. So I'll say, Terry, when your dad left you at the supermarket when you were 6, what words go best that describe your negative belief about yourself now? And you'll say that I'm not loved. And then I'll say, Terry, what would you like to believe about yourself when you bring up that image of your dad leaving yourself at the supermarket when you were 6? And you may say, I'm loved. And then I'll say, okay, when you bring up that image of your dad leaving yourself at the supermarket or leaving you at the supermarket, how true to the words, I am loved, feel to you on a scale of 1 to 7, 1 being completely false, 7 completely true? And you'll say 1. And I'll say, great, let's close that gap and let's get you to the point where you actually believe that you're loved. So then we process it. And the protocol is pretty straightforward, but we go through the processing of it. And you get from not believing that you're loved to you're loved. And it holds. It holds. And the charge associated with being left at the supermarket goes from being a 10, which is the most of distress, to a 0. And
spectacular.
It's pretty spectacular. And then 9 times out of 10, I'll say, can you bring up the memory? And you'll say, yeah, I can, but it's pretty distant. And there's a theory called working memory theory. And what we want to do is in EMDR is degrade the memory and wear the memory out. Because as trauma survivors, we spend a lot of time avoiding and averting a traumatic event. If we look at soldiers who come back from being in Afghanistan, being in Iraq, being in Israel, being in the Ukraine, what's one of the hallmarks of PTSD? Aversion, avoidance. And what do? What do the soldiers often turn to? Alcohol and drugs.
Yeah.
That's because they can't go there.
Avoid and be, yeah.
So if we can gain their trust, escape, they need to escape. If we can gain their trust, and help them to see that they just have to spend 15 or 20 minutes looking at a very painful event, then their lives change. And the desire to medicate is reduced. They still have to go through the period of withdrawal, but we can do that. But we knock off each of those painful events. If I can work with a woman who lost her 10-year-old baby to SIDS, sudden infant death syndrome, which I've never seen a person in more pain than processing that. Today she's fine. She's functional. They've had a third child. Then the EMDR it's a pretty powerful tool.
And that's work. You work through that client that client using EMDR.
I did.
And do you find? I know that at Prospect Hill, 2 of the therapists that also are huge believers in EMDR and utilize it. They start there once the patient's been medically, safely detoxed and stabilized. They begin that process. And if a patient's only going to stay, they're not going to stay 90 days, maybe they're going to stay 45 or 60, then that you're able to pick up by having a conversation with that therapist and you're able to continue that work?
Absolutely. Yeah. Well, we need to assess first if there's any schizophrenia, any severe bipolar. They have to be semi-stable, not super stable. But EMDR is not appropriate for folks who have severe mental illness.
Yeah.
And sometimes there's alcohol-induced mental illness, sometimes there's substance abuse mental illness. So once they get sober and once they're on a bit of medication, then it's often very helpful. EMDR is not for everybody. But we can absolutely pick up where the work starts when they're in treatment. We also have a few digital platforms that we use to use EMDR remotely, which is arguably more effective.
When you talk about a client that you saw that lost a baby to SIDS, how often do you see that client, and how long are the sessions?
I only saw her 3 Saturdays in a row.
Wow.
Yeah, and those were longer sessions. Those were a couple hours each. It was pro bono work. I'm not going to charge a woman a dime to process that. If she's going to go there, I'm going to go there. So that was a fairly quick intervention. I just worked with a woman in 3 sessions to process the illness of her father. Her father had a stroke. She went to the hospital, saw him. He subsequently recovered. He's fine. But she needed to go through that. She needed to move through, moving from the waiting room into the ICU to see him on life support, to getting well. Traumatizing, exactly. That's her daddy. And we got through that. And I know that when I follow up tomorrow with her, we finished up last week, she's going to know, she'll see something like, I remember, but it's not bothering me. We can be very discreet and very focused on events, and that's what we have to do when we put together a timeline. So, I asked him to put a timeline together starting from 0 to 5, 6 to 10, 11 to 15. And then we identify the most difficult, the most painful, and that's where we start.
So that timeline is timeline of events that were traumatic to that person based on how old they were, things that they remember.
Exactly, and I focus on just pain points. Mm-hmm. And I had a woman come up with 146 pain points, and those normally silo down into 3 to 5 different areas of life. One was with her dad, one was with an abusive school teacher, one was with her experience with alcohol and drugs. Mm-hmm. And when we go after the big ones, the other ones they pale in comparison, and they gain so much confidence and regain so much self-esteem. They don't really need to look at the other ones because they've developed agency to look at things on their own and move mm-hmm. through them. Does that make sense?
And they're getting the tools, and they're feeling the process, and
exactly.
They're feeling that it's not as scary to go there as they thought it would be.
Exactly.
Earlier on, you talked about, alcohol and drugs are but a symptom of the problem. It's something else, and trauma being one. And, I've heard there was a doc in Chicago many years ago, John Meisner, that used to say it's the alcoholism, is the ism, the ISM, the inside me that I have to deal with now that the alcohol's been removed. When you talk about being a certified sex addiction therapist and working with those clients and all those situations that those bring, is it also trauma? Is it a big trauma? You find that trauma is involved with a lot of sex addiction as well and sexual compulsivity?
That's a really good question. So sex addiction it's a disease of loneliness. It's an often attachment disorder underneath, insecure attachment with mom or dad. And it's an intimacy disorder. And the internet is not helping things. The pornography is the pandemic. That's the true pandemic. We thought COVID was the pandemic. No, pornography is. Name a man who doesn't look at pornography and hasn't looked at pornography. It's a problem.
Well, it comes up. Whether you want to look at it or not, something comes up that looks like some sort of pornography, maybe not, to the nth degree of intense pornography.
No, but there's teasers. Stuff pops up on Reddit, stuff pops up on X, non-solicited, and we get drawn in. It's like a little teaser. Pornography pays. It's clicks. Right. So we were talking about attachment disorders. And what does that mean? It means it's hard for some folks to develop secure attachments with other people. Even on a friendship level, but on a romantic level even more. Some people are securely attached, some people are insecurely attached. There's avoidant attachment, there's anxious avoidant, there's just anxious attachment. There's a matrix, and we all fall someplace. And that's also something we need to work through.
So that's one of the key symptoms and that's a question that I had from the audience was, what are the key signs of sex addiction that you see with your patients, and how can you tell if your partner is struggling with sex addiction?
Yeah. Well, I think a partner knows something's off. Intimacy starts to wane. And I don't necessarily mean sexual intimacy, physical intimacy. I mean emotional intimacy. Mm-hmm. They're checked out. They're isolating. There's time which is not accounted for. There's time away from the relationship. And then there's the frequency of intimacy, of physical intimacy. If it goes from 2 or 3 times a week to once a month, mm-hmm. something's off. Something has to be addressed, and it's often communication. And as sex addicts, we're often not the best communicators, and we have to learn to communicate. Yeah.
And that might be how somebody presents to you in practice, is that
right.
We're having an issue in our relationship.
Right.
There's something going on, not sure what it is.
Right. Or or a partner wants to bring, another partner in, another person into the relationship and explore with a third party, which is fine so long as it's discussed and it's not coerced, and that's great. But it has to be talked about, and it has to be wanted and required and requested by both parties.
How do you control a sex addiction?
Well, we push for 90 days of abstinence. We push of 90 meetings in 90 days. We have to stop acting out somehow, some way. Sometimes that means moving from an iPhone to a flip phone. Sometimes that means installing covenant eyes on all technology. Sex addicts always get caught, by the way. Mm-hmm. It either shows up on a kid's iPad or some interaction with a third party. Wow. It shows up someplace on technology. And it's not a matter of if, it's a matter of when. Mm-hmm. And I'm sorry, what was your question?
About how you control sex addiction.
Yeah, so I don't. You don't. Nobody does. The addict does. The addict has the agency, and that's part of what we do is we help them develop agency, and we push them to 12-step meetings, or we push them to a church program. We encourage celibacy, and we coach them through the withdrawal period, which is very difficult. Mm-hmm. Patrick Carnes says it's akin to withdrawing from heroin, and I think it might even be more difficult. Mm.
When I imagine it's usually the partner that shows up in your office first saying, "Can you see my..." Often, and I generally don't work with mandated clients. Mandated meaning? Meaning from the partner, from the husband or from the wife. I say, well, have them call me if they want some help. I don't work with people who need help. I work with people who want help. Does that make sense? It does. It does. And when you're working with them, what would you say in all the tools in your toolkit? What's the most effective tool that you teach people to utilize that you're seeing the most efficacy with? Well, we have to break through denial. So at CSAT, we have a 700-question survey called the Sexual Dependency Inventory. 700 questions. Yeah. It measures preoccupations, meaning what are you preoccupied with sexually, meaning what do you think about, what turns you on, what turns you off. No, it's really what turns you on. What are your behaviors? What are your kinks? Where are you on the continuum of homosexuality versus heterosexuality? How much time do you spend online? There's questions about men's items, women's items, attachment style, crisis decision. Where is the individual as far as making a change? Are they in denial? Are they ready? Are they in crisis? Are they past crisis? Are they in decision to make a change? So those 7 questions will then feed you information as a therapist. It's an MRI of one's behavior. And you'll get some sort of a readout, right? You don't have to score it yourself. It all comes pre-scored. It comes scored, so It's probably been taken by 10,000 people at this point. Wow. And then you, based on that, you're like, this person needs residential treatment first, or... Exactly. And it gives us a score of 0 to 20. So anything above 6 indicates a problem, most likely. And I normally see 12 to 15s. So when they get to me, there's usually a pretty serious problem. Yeah. What makes a place like Prospect Hill, being in the Caribbean, being a 7 patient max program, ideal to refer patients to? Well, it's peaceful. It's isolated. We need them to sign an oath of celibacy, mm-hmm. which they can talk about in group if they're comfortable with. They can talk about individually with their therapist, because it's not easy. Those first 2 weeks are hard. That means no masturbation. That means practicing the 3-second rule, and I call it the 1-second rule, where you don't look at a person for more than 1 second. You don't objectify a person for more than 1 second sexually. Wow. And that takes work. That's hard work. That takes a lot of energy, because we're really going against ourselves. Yeah. As sex addicts, we're trained. We're always on the lookout for potential acting out partners. Every time we go into Milam's, every time we go into Fresh Market, every time we go to the mall, every time we go anywhere, we're looking out. Scanning. We're scanning. Yeah. We're vigilant, right? And the partners will pop up. They're scanning too.
So when you meet a partner, when a sex addict sees someone else, they connect. It's strange. It's like telepathically, they're like, oh yeah, I'm going to hook up with that person.
Wow.
Even though I'm with my family and my wife and we're celebrating my son's 18th birthday, I'm somehow going to make contact with that person.
And they find a way somehow to do that and make
Yes.
that connection.
Yes.
That's wild.
Yeah.
Let me go to.
So we also have tests, surveys for trauma. We survey for trauma. I use the CAPS-5, which is what the VA system uses to assess for. We would look at the MMPI. We would look at the Milan. We're always looking for narcissism. Mm-hmm. Most male addicts, some female addicts, have features of narcissism. They have some of those 9 features of narcissism. We don't have to look far to see examples of people with extreme narcissism in our lives today. The gentleman who's running our country he ticks off, like him or not. This is not a political statement.
What's a sign of trauma that you think most people completely overlook?
The inability to maintain consistent relationships with people, friendships. Yeah, distrust.
Distrust.
Okay. They've been betrayed, so why should they trust?
And does trauma, and if so, how does it? Does trauma actually rewire the brain?
Yes.
And how does that get reversed? How can you reverse that?
Slowly, gradually, by forming relationships that evolve slowly and gradually over time.
And that's something in practice that you coach people and...
Gradually, we call it gradual intimacy.
Okay.
That's a really good question. We only learn about relationships by being in relationships. We only learn about relationships by being in relationships. So for a person who's struggled to be in a romantic relationship, mm-hmm. I encourage them to explore that, non-sexually, to have a healthy dating plan in place. Like you're going to meet once a week in public and just get to know each other. Netflix has a series, I think it's The Orthodox Dating Coach, and she gets it right. Like her or not, she gets it right. She's like, no touching, 5 dates, in public, no touching, and then you can hold hands maybe.
And is she a sex therapist?
No, she's a dating coach. She's a dating coach, but she gets it very right.
Because she's teaching people that don't know how to have relationships.
To have relationships and to go very, very slow. But I also think her teachings apply to everybody who's dating. Mm-hmm. Intimacy is developed over time. Intimacy is into me, you see. It's about talking about our dreams, aspirations, goals, fears, and opening up about those with another person with whom we feel safe.
Can you say that again? Intimacy?
Intimacy is into me, you see.
Wow.
I'm repurposing that from an AA sponsor who wasn't my sponsor, but he was around the rooms about 20 years ago. Yeah.
I mean, that's, and to me, it seems like the whole CSAT, sexual or certified sexual addiction therapist, and sexual compulsivity issues, it feels like they've really only come to the surface over the last, I'm going to say, 25 years. Maybe it's been a little bit longer than that. But now you mix in what we have with hits from social media and internet to the brain, and it just seems like there's just so much activation going on that the struggle is.
How about billboards? And I don't think alcohol companies can use billboards anymore, but for a long time they could. And they're usually in bikini-clad, muscled men, and that's triggering. It's everywhere. It's everywhere. I should also mention that sex workers don't just become sex workers. Mm-hmm. They don't just wake up one morning and say, I'm going to become a stripper, I'm going to become a hustler. Bad things have happened to them. They've been sexually abused, and they're reenacting whatever's happened to them in exchange for money, but also in exchange for control.
In exchange for control that they didn't have.
Right, the transference is I'm controlling this person. Right.
Yeah.
And often their arousal template is based on what happened to them initially sexually. So if they were abused by, if a woman was abused, a 12-year-old was abused by an uncle, she's going to reenact that with an older man.
And do you find, because you've laid out some really clear examples about difficult clients and cases, and I know that most therapists will see somebody individually once a week for an hour. Do you find that sometimes you say, hey, in the beginning, I think I'm going to need to see you?
Absolutely.
More?
Yeah, absolutely.
You do? Okay.
Yeah. Or come once or twice a week, but also join one of my men's groups.
Okay, yeah. Talk about that.
Well, groups, the dirty secret is where is that the real work happens in groups, because a client is going to learn and is going to listen more to his cohort of 6 or 7 peers than he is his dumb therapist. He really is.
And you can't hide in a group of 6 or 7 people.
It's pretty hard.
Yeah.
9 times out of 10, last night I heard I wasn't going to say anything, but I'm glad I'm saying this.
Yeah.
And then they spill out, and then they're loved, they're encouraged, they're applauded. They're like,
by their peers.
Yeah, we're like, thank you, we've been there, keep talking. And it's not okay, but it's okay.
It's a super
Next time call us before.
Yeah.
But as you know, the relapse happens way before the actual consumption of the act. So groups are hugely effective. It's where we see the most growth.
Yeah.
It really is. The combination of individual and group work is where there's a lot, as well as 12-step work.
You must have just pulled that. You read my brain without me even saying it. That's exactly my feeling and my experience as well, as individual therapy, group work, and mutual support group.
Right.
Forming bonds and relationships with members of the same, say with members of the same sex. With
a heavy dose of psychoeducation.
Yeah.
And Patrick Carnes says it's 3 to 5 years. And we have a whole set of tasks that we do, that we offer sex addicts who want to do that work. And we use the task work. It's a big part of what we do. We look at the denial system. We look at the personal craziness index. We look at excuses. We look at abuse. We look at a lot of different areas. And he says it's 3 to 5 years. I hope it's not that long, but sometimes it is. And there are people that do get sober. Yeah, I work with chemsexers, meaning the gay population who combine methamphetamine with sex, and they go for 24 to 72 hours. Because meth is plentiful, it's available, it's not expensive. Yeah. Forgive me.
We're fortunate to have you as a gifted healer. I know you're very humble, but you're a gifted healer, and we're fortunate to have you in this community working with people the way you do. And I think that we go through what we go through to get where we are, and the fact that you had this other career in life to get where you are today is a power greater than ourselves got you to this point, and grateful for all the great work that you do, Bryan.
Well, thank you. Can I talk about EMDR 2.0?
Yeah.
EMDR 2.0 it's intensive EMDR. We use it for PTSD, also complex PTSD. And we combine what's known as, they call it, it was started by a few Dutch psychologists whose names are Susie Matheson and Ad de Jong. And they have a whole base of research, which I'm happy to share. But we combine prolonged exposure therapy, they call it imaginal exposure, with exercise and with EMDR. So we use the exposure therapy to bring the event forward in the morning, take a break, they get some exercise, they get some lunch, they come back in the afternoon.
Wow.
And they do the EMDR to process the event. And in Holland, in Utrecht, they do 4 and 8 week, 4-day and 8-day sessions. And they get through a lot of trauma in those days. I mean, it's very intense, but it's also extremely effective. It works for borderline. It's effective for borderline personality disorder.
Really?
It's effective
Is
for...
that a clinic there in Holland?
It is.
Yeah.
They've worked with 10,000 different people.
Wow.
They're the EMDR is used more in Europe than it is in the United States because it's non-pharmaceutical, and it works. It holds.
Although the founder was from the United States.
Right, exactly. Shapiro. Francine Shapiro she was a New Yorker.
Yeah.
And she discovered that when she was walking through New York, walking through Central Park, when she moved her eyes from one side to the next, thinking about something painful, the experience lessened and the trauma went away.
Amazing.
Yeah.
Amazing.
Yeah.
Thank you, Bryan.
Thank you, Terry. Thank you for having me.
Appreciate it.
I hope this has been helpful.
Yeah. Tremendously.